Hello everyone, welcome back to the Cognitive Behavioral Therapy video series, video 4. Today we'll be talking about the evidence-based effectiveness of CBT. CBT is one of the most extensively researched and empirical supported forms of psychotherapy. This presentation will outline the scientific evidence backing CBT, the effectiveness across different populations, and why it remains a gold standard in mental health treatment. So, CBT, as we know, is a structured, goal-oriented, and skills-based approach. It focuses on changing maladaptive thoughts, patterns, and behaviors, and it has been empirically tested across diverse populations. Organizations like the American Psychological Association and the National Institute for Health and Care Excellence endorse CBT as a first-line treatment. This presentation will help explore the support behind CBT and its applications across different disorders. As we see, CBT is as effective as medication for treating depression and anxiety. It is widely recognized as one of the most effective evidence-based treatments for treating a range of mental health disorders. Research has consistently demonstrated its efficacy in treating conditions such as depression, anxiety, PTSD, and more. So kind of diving in. So there has been numerous meta-analysis and randomized controlled trials to support CBT's effectiveness. Some of the strongest evidence includes like a depression, a meta-analysis by, don't want to slaughter the name, I don't even want to try, found that CBT is as effective as antidepressants for mild to moderate depression. Where in anxiety disorders, Hoffman et al. In 2012 showed that CBT significantly reduced symptoms of generalized anxiety disorder, panic disorder, and social anxiety disorder. And looking into PTSD, trauma-focused CBT, TF-CBT is also for what is known, has been shown to reduce PTSD symptoms in both adults and children in Ehlers et al. In 2010. And in OCD, we see the exposure and response prevention, ERP, a CBT-based intervention, is the gold standard for treating OCD treatment with Abramowitz 2006. So these studies just kind of help highlight why CBT is recommended as a first-line treatment by mental health organizations. So we see in the next slide, we can go over and see how different populations can also be treated by CBT. So CBT is effective across diverse populations, including children and adolescents. So this can be used for treating anxiety, depression, ADHD, and conduct disorders. Often involves parental involvement, so this could be parent training or for child behavior management. This can also be used in older adults, so this can be adapted to address cognitive decline and late life depression, kind of getting at those cognitive distortions. Culturally diverse populations can also be treated with CBT, as it can be culturally adapted by incorporating beliefs, values, and linguistic modifications. And there has been numerous studies to show how culturally adapted CBT improves engagement and treatment outcomes. So by tailoring CBT to different populations, therapists can ensure greater effectiveness and accessibility. Next, long-term benefits of CBT. So, the long-term benefits and relapse prevention. Unlike medications, which only work as long as they are taken, CBT teaches clients skills that they can use for life. So that is one of the greatest strengths of CBT, is that the ability to provide long-term benefits. Study shows that CBT has lower relapse rates compared to medication alone, especially for depression and anxiety, and clients who complete CBT are more likely to maintain progress because they develop problem-solving skills, emotional regulation strategies, and the ability to recognize and change negative thought patterns. So research suggests booster sessions, so follow-up therapy sessions after the treatment, can help reinforce CBT skills and further reduce relapse risk. So this was just a little bit about how CBT is effective. However, I do want to mention there are some limitations. While CBT is highly effective, it has some limitations. So it's not a quick fix. So clients must engage actively in the process, which requires motivation and effort. And this is not suitable for everyone. Individuals with severe mental illness, such as like psychosis, may need additional interventions beyond CBT. There's also some limited emotional processing. Some clients may benefit from emotional focus therapies if their issues are deeply rooted in trauma or attachment wounds where there is still some the trauma forced CBT, however, may just help with that emotional focus therapy. Would just suggest with CBT and any therapy, it's always dependent on how your client is and their issues and what fits what with them. Because also there's some accessibility barriers, so not all clients have access to trained CBT therapists. So you do have to get trained to be a certified CBT therapist. But however, nevertheless, CBT still remains a gold standard for people just to even practice and have it. They don't even need to get if they don't want to get certified, just to get like the ground roots of it, because it continues to be one of the most widely studied and applied psychotherapies due to its strong support, the decades of research behind it, the effectiveness across various disorders, depression, anxiety, PTSD, OCD, and more. And there's just more research coming out to help go with other disorders. And the long-term benefits. So there's lower relapse rates compared to just medication alone. It is a very structured, goal-oriented approach that empowers clients to take control of their mental health and adaptability for different populations and settings. So children, older adults, culturally diverse groups really makes it a highly gold standard in the mental health field. And as research advances, CBT continues to evolve, incorporating new techniques and digital interventions to make treatment more accessible. So all in all, CBT's evidence-based effectiveness makes it a powerful tool in modern psychotherapy, and it still remains a first-line treatment recommendation worldwide. Next, we're going to be taking more at those looks and advantages of CBT in the next video. Thank you.